Sleep apnea is a disorder that is a closing of the air passageway during sleep.
What happens is when you're sleeping, the throat muscles actually relax and the tongue can fall back into the airway, actually blocking and occluding that airway, which prevents you from getting oxygen to your vital organs. You're not getting oxygen to your heart, you're not getting oxygen to your brain, which, as you can imagine, can cause some pretty serious long-term issues.
High blood pressure, heartburn. Daytime sleepiness is the most common complaint due to the frequent awakenings that occur during the night when people can't breathe. But the awakenings are so brief, maybe 3 to 5 seconds, that they don't register on the conscious memory, but they are in fact occurring, and that's what causes the symptom of daytime sleepiness or fatigue.
What we can do at our office is make special appliances called mandibular advancement devices, called MAD appliances, that actually hold your mandible, which is your lower jaw, in a forward position. By putting it in that forward position, what it does is it opens the airway, so when you're laying on your back, when you're sleeping and laying down, your airway is open.
So for people that have specifically positional types of sleep disordered breathing, that is, it's worse when they're on their back, that would indicate that gravity is pulling the tongue back. These people do better with a dental appliance. Some people have sleep disordered breathing where it's most common in certain body positions or certain stages of sleep. Dental appliances tend to work very well in those cases too, because stages of sleep may predict muscle tone and movement of the tongue, and therefore dental devices may be very, very effective.
Once a patient sees a sleep specialist, okay, a sleep physician, then they get a proper diagnosis, they're then referred to our office, okay, in which case we start with an initial comprehensive exam. There are certainly things we want to look at in our examination to make sure they'd be a good candidate. Not everyone is a good candidate for a dental appliance, but we want to make sure that they are before we make them one.
I chose Dr. Malarkey after doing some research on a list that Dr. Warren gave me. She was actually out of my insurance network. And the others mostly were in my network. But I wanted the best doctor for the service, not so much the cheaper price. So I decided to make the appointment, come to see her, and after seeing her, I was very, very happy with her style, her demeanor, her knowledge, her expertise, and just asking a lot of the questions about the appliance. She was very, very, very well versed on it, as compared to my general dentist who offered to do the service was the opposite.
She's easy to work with. She's responsive when not just when you're coming in for an appointment, but if you call and ask questions, she particularly will either call or her staff will. The staff is extremely friendly, personable, easy to talk to, easy to relate to.
She uses the latest techniques and the latest devices. My clients that have seen her have had outstanding results with the quality of their outcomes.
It's more than just a device. It's actually the right device for the right mouth, the right condition, and she knows how to manage that, obviously, with expertise. She knows how to make the adjustments to that device, pick the right one. There's a variety of types depending on your situation, and really optimize that.
Millimeters have an impact on how effective the actual sleep appliance is. So being able to make those adjustments and having the knowledge around which ones are going to make a difference, combined with her having a dialogue with my existing doctor that helped diagnose me with sleep apnea was important to me.
She and I work very closely to make sure that the devices are effective, comfortable, and do exactly what we want them to do.
It's well worth it for the expertise she brings, plus the results I'm getting after getting fitted with the appliance. I've been very, very happy with it. It's night and day, and I can turn and sleep any direction I want. It's great. It's really a bit of freedom again.
If you're concerned that you may have sleep apnea, or if you've had a sleep study done and have been diagnosed with sleep apnea, I welcome you to come to our office for a complimentary consultation. I'd love to sit down with you, go over your options, and get you taken care of.